Hi everyone, welcome to Medical Terminology. I'm going to do a quick mini lesson on Chapter 3, and we're going to talk specifically about the knee, because the knee is a complex structure and it includes all of the different tissue types that the chapter discusses. And it's got a couple of new word parts in there and an abbreviation or two. So let's talk a little bit about the knee. So I'm going to present my screen so you can see it. And all right, so you should be able to see my screen now. Let's get that out of there. All right, so this is just a modified version of the PowerPoint. It's not the one that's in your Blackboard, but it's just a modified version. So, all right, so the primary tissue types that you have are connective tissue, epithelial tissue, muscle tissue, and nervous tissue. And remember, different tissue types are made up of specialized cells that all work together for a specific purpose. That's the definition of tissue types. All right, so we're going to see all those different tissue types in the knee joint. So this is an anterior view of the knee. So you're looking directly at the front of a knee. Now you can tell that this is can you guess, is it right knee or a left knee? What do you think? So this is a right knee, and how can I tell just by looking at it? I can tell because the fibula over here is on this side. So I know the fibula is lateral. So if you reach down and touch the outside of your knee, that little bump on the outside is actually the head. Oops, I went too far, sorry. The outside over here is actually the head of the fibula. That little bump on the outside of your knee is the head of the fibula. So I can tell by orienting myself in the picture that this is the right side. All right, so I'm going to say this is a right side and this is the left side. Now, whenever we're talking about directions, I'm going to do a little presentation about directional terms and anatomic position and things like that. It's always, always, always the patient's right or left. So when you're looking at this picture, this would be the patient's right and this would be the patient's left. So that's really important when we start talking about things like medial and lateral, because now you'll see that everything over here is lateral, right? And everything over here is medial. Why? Because this would be the person's midline and this would be on the outside, right? So this would be the person's right and this would be the person's left, okay? So everything over here would be on the middle and this would be on the outside. Does that make sense? Okay, so the three bones that make up the knee joint, include the femur. I'm going to highlight them here. Include the femur and the tibia, and the one that you don't see here because we've cut it away would be, I'm going to draw it in this pen over here, would be the patella, which is much bigger than what I'm drawing here, but it would be right there when we've cut it away. The fibula over here doesn't actually articulate with the knee joint because it doesn't do anything with the joint. It's over here, it's down below where these three bones actually articulate or join. So the fibula is not actually part of the knee. It's actually over here to the side and below. All right, so don't get tricked by that. The three bones of the knee are actually the femur, the tibia, and the patella. Okay, let me get my drawing back over there. So what types of connective tissue are found in the knee? Lots of them, basically all of them. All right, so bone is the first one. We were just saying the three types of bone. So bone tissue, it's the hardest of all the connective tissues because it has those calcium and mineral salts in the matrix. So calcium and phosphate are the mineral salts there. The three types of bone tissue that are mentioned or the three types of bone cells, I should say, that are mentioned in the chapter are osteoblasts, osteocytes, and osteoclasts. So we have that term osteo. Let me try and type it here. Ooh, my handwriting is terrible with the mouse. Sorry. Osteo means bone. All right. See if I can get a text box in there. That would be better, right? Osteo means bone. So we have osteoblasts and osteocyte, and then an osteoclast. So an osteoblast is a cell that builds new bone, lays down new bone matrix. An osteocyte, site means cell, So an osteocyte is a mature bone cell, and then an osteoclast is a cell that destroys or tears down or dissolves bone matrix or bone cells. So remember, bones are constantly, you probably remember this from A&P. If not, if you haven't had A&P yet, you'll get to this. But bones are constantly remodeling and reforming. So osteoblasts are building up bone matrix, and osteoclasts are destroying bone matrix. So they kind of build and remodel constantly. So those cells are constantly being built up and then destroyed. So the osteoblasts and the osteoclasts work together to reshape and remodel our bones. Okay. So the next kind of bone tissue that we have is cartilage. So cartilage is a type of tissue that has a rubbery sort of matrix, and matrix is the stuff that the cells sit in. And the cartilage provides, in the knee anyway, provides some shock absorption and reduces friction where the bones meet. So in this picture, the cartilage, let me get back to my drawing here. The cartilage is here between the bones, and this is our meniscus, right? We have two menisci. Each one is called a meniscus. The plural is menisci. If you put an I at the end, that's the plural form. We have a medial on the inside and a lateral on the outside meniscus. And those pads of cartilage provide some shock absorption and cushioning for each step that we take. It absorbs a lot of the force. It's a very poor blood supply with cartilage, so it's very poor healing. So if it gets damaged, it takes a long time to heal, if it heals at all. Wear and tear on that cartilage results in things like osteoarthritis. That's when the cartilage breaks down and you have bone rubbing on bone. That friction that results gives us the pain of osteoarthritis. And we have words like chondro. Let me get my text box again. Text box, right there you are. Chondroblast. And chondrocyte. For cartilage, just like we had with bone, chondro means cartilage. That's our word part that means cartilage. And blast, we know, is an immature cell. And cyte means mature cell. So a chondroblast is an immature cartilage cell, and chondrocyte is a mature cartilage cell. Okay, we don't have any of those destroyer cells like we do in bone. All right. The next type of tissue that we have are ligaments. And we have a bunch of ligaments in the knee, and ligaments are bands of fibrous connective tissue that help to reinforce and stabilize the knee. The knee is very freely movable, so it's very unstable. It's an unstable joint. So we have lots of ligaments in the knee. Let me see if I can get a different color here. Let's do purple. I like purple. So lots of ligaments. Here's a ligament here. There's ligaments within here, within here, within here. Oops, that was terrible. Within there. So here's the ligament, a lateral collateral ligament. There's a transverse ligament. There's a medial collateral ligament. There's a patellar ligament it's been cut away so you can see it, but it basically holds the patella in place and attaches to the big quadriceps muscle. Those ligaments connect bone to bone. So you can see a good example here, this lateral collateral ligament. It connects the femur to the head of the fibula. This medial collateral ligament connects the femur up here to the tibia. All right, so ligaments connect bone to bone. All right, there's ligaments inside the inner aspect here. This is your anterior cruciate ligament and your posterior cruciate ligament. So you've probably heard of your ACL, right? I'm sure you've heard of your ACL. My text box, there's gotta be a better way to do this, right? Your ACL, there's an abbreviation for you. That's your anterior cruciate ligament. That gets torn often, especially in football players when they get tackled. They get struck, right, if they get tackled this way, right? They get struck this way and their knee kind of opens up, this way, and that force tears their ACL and their medial collateral ligament this way because the force of the knee opens up, and their ACL gets torn. And again, like cartilage doesn't have a great blood supply, so that usually needs surgery to heal. Tendons are similar to ligaments in that they're tough bands of fibrous connective tissue, but tendons connect muscle to bone. So instead of bone to bone, tendons connect muscle to bone. And tendons, excuse me, are the outer portion, the outer capsule of the muscle, and it's the extension of those outer capsules that connect the muscle to the bone. So that's what a tendon is. It's just the outer sheath of the muscle that connects to the bone. So I don't have a good picture of a tendon here, but you can kind of see it here. This, if you imagine the quadriceps tendon here, if this, you imagine it goes all the way up. If I continued this drawing, ooh, I can't draw here. Why can't I draw here? I continue drawing there. If I continue this drawing up here, right, this would be the tendon. If this connects to the muscle, right, so it connects there, that's the tendon because the band of connective tissue continues on. All right, it's just an outer extension of the muscle. So that's one place where your textbook is not exactly correct. I think your textbook says something like tendons are another type of ligaments. They're not exactly the same thing as ligaments. All right. Another thing that your picture here doesn't actually show is the joint capsule. Can I draw? Where's my pen? I draw with my pen. Okay. Around the whole joint is the joint capsule. And the joint capsule is a thin collagenous or collagen containing connective tissue. Oh, ligaments, sorry, let me go back to ligaments for a second. So ligaments contain collagen fibers that are all set up in a row. They're parallel to each other. Sorry, I put that right in my face. Collagen fibers all in a row, and those collagen fibers give the ligaments strength. So they're all lined up in a row, and they give the ligaments strength. And tendons have those collagen fibers as well, and that gives them the strength. And there's lots of them, and they're packed right on top of each other. So it gives them a lot of strength and also some flexibility. So the joint capsule also has some collagen fibers in it, but they're just not quite as dense, as densely packed. They're a lot thinner. So it still has some strength, but they're not quite as durable. So the joint capsule surrounds the whole joint, but it's very, very thin. All right. And that joint capsule has a lining. If you imagine a lining inside that joint capsule, it's lined with something called a synovial membrane. And that synovial membrane secretes synovial fluid. And that synovial fluid lubricates that joint, reduces friction, and provides some nourishment to the cartilage inside. Because remember, the cartilage doesn't have a great blood supply. So it reduces friction and nourishes the cartilage inside. All right, so far we have bone tissue, we have cartilage, we have ligaments, we have tendons, we have a joint capsule, we have a synovial membrane. We also have muscle tissue, right? There's muscle tissue up here. We have the quadriceps femoris, which is one of 4 muscles of the anterior thigh. That helps to stabilize the knee. And then in the back, we have a muscle called the semimembranosus, which is one of the hamstring muscles. Your chapter mentions that. That also helps to stabilize the knee. The quadriceps will pull on this tendon, and that will extend the knee. So if you can imagine pulling on this tendon, will extend the knee straight out. The semimembranosus will pull back here on the tibia and will flex the knee. So you imagine pulling back here, it'll flex the knee. And then, of course, the last type of tissue we have is nervous tissue. And nervous tissue, of course, is throughout the whole knee and will give feeling to the whole knee, right? So knee injuries are very painful. just because it's such a complex structure, and knee injuries are actually quite common because it's such an unstable structure. There's so many things going on, and it's so easy to injure because it's so complex. All right. So let's see. Did we cover everything over here? Lateral, medial, lateral, fibula, tibia. And you know what? One of my pet peeves. Look at the spelling on this word, fibula and tibia. Please don't pronounce this fibia. It is fibula and tibia. So be sure that you're pronouncing that correctly, okay? All right, I think that covers everything in the knee. We covered osteoblast, osteoclast, and osteocyte. And I think that's it. I'm going to do another little mini lesson here in a little while so we can, no, I don't want to say that. So we can go over the next section, which is abdominal stuff and directional terms. All right, so if you have any questions, of course, send me an email. And that's about it. I look forward to seeing you.